campaign, which was established early in 2021. And thanks to the Community Foundation for funding this campaign. Now, members of the campaign include As I Am, Bernardo's, the Children's Rights Alliance, Inclusion Ireland, the National Parents Council Primary, Pave Point, Children's Books Ireland, the Dyslexia Association of Ireland, spunout.ie, the Society of St. Vincent de Paul, and UNICEF Ireland. Now, as some of you will well know, the Children's Futures campaign has been vocal of the importance of schools remaining open. And now we're all very pleased that schools are open, but we're also all very concerned about children's well-being. We all know that the school community has a vital role to play in the National COVID Recovery Plan. And we all need to make sure that services are made available to implement the government's education wellbeing policy framework, which recognises that school is not only a place where children learn educationally, but it's crucial to their social, emotional, and physical well-being. So this event could not be coming at a better time. Now, the event is going to be recorded, and it's also being broadcasted live on our Facebook page. Please do join the conversation on Twitter. It's hashtag Children's Futures Ireland. And also, we really encourage you to put in questions through the question function. It's now my great pleasure to introduce somebody I know well, which is Professor Pat Dolan from NUI Galway and UNESCO Centre for Children. And he's going to give us a very interesting presentation on children, their well-being and resilience in that context. Over to you, Pat.
Thanks very much. And it's great to be with you this morning. And as Suzanne says, this is an important occasion really to think, in a way, I think, for us to take some stock and think about well-being, not just in the context of the pandemic, which we're all coming out of, hopefully, and seeing the back of, but also in the context of the lessons that are to be learned for school systems in relation to well-being. And what I'm going to try and do over the next 30 minutes or so is really to kind of whet your appetites for the webinar this morning and for the discussion this morning. And I know Anya and various people are speaking after me, but just really what I wanted to do, or what I'd like to do today, is really, in a way, give you a flavour of some of the things that I think are crucial in relation to understanding well-being in school systems and related issues. So I'm hoping this is going to work and that you should be able to see my slides. So can you tell me if you can see those slides, anybody? Is that working?
Pat, we can't see any slides yet.
Okay, that's okay, just one sec, sorry, excuse me now. Just one sec, try once more. Just bear with me 1 second. Okay, can you see that now, Suzanne?
No, we can't see any slides yet. Would it be helpful if we asked our Stephen to see if he could help with it? Okay.
Sorry about that. Yeah. Thanks, Suzanne.
Well, maybe, Pat, if it's okay, just while we're waiting, maybe I could just ask you something that interests me. One of the things that you have always been passionate about is resilience.
Yes.
And resilience in children. And do you have a view of how you think COVID might have impacted on children's innate resilience?
Yeah, absolutely, and it's something that's been looked at quite a bit at the moment, and rightly been looked at. So kind of some of the evidence that's emerging, particularly from UNICEF studies, and one that I'm involved with myself globally with UNESCO, and this is particularly looking at latency age group and early adolescence, is that that's great things. The issue is that those who are marginalized are being more marginalized in terms of the their own capacity to be resilient has been put further back. Whereas young people who have the skills, and I'll talk about this in a while, the skills to be resilient, in the first place, they were able to mobilize those skills to cope with lockdown. Whereas for young people who were marginalized in some way, particularly in their education, that marginalization further impaired their capacity to demonstrate resilience. So, yeah.
Okay.
So that's great. Thanks very much, Stephen. Sorry about that. We're ready to go. So if you could go to the next slide, please. Thank you. So as Suzanne mentioned there, there are three factors that I think are really key to understanding well-being and school systems, and particularly in relation to the mental health of young people, children and adolescents in school. And that relates firstly to be resilient, if we stick with that one, and that's the capacity to overcome the odds, to bounce back. But we've got to remember that resilience is not just a coping, it's a way of understanding coping. Resilience really has to do with being able to do better than expected, to thrive in the face of adversity. So we'll come back to how that can happen within the context of good well-being structures in school and education systems. The second item that I really want to raise today, and we'll focus a little bit on, is empathy and the connection between well-being and empathy. So empathy is not sympathy. Empathy is the capacity to actually understand where another person is coming from, and that's cognitive empathy. And then you have effective empathy, which is the capacity to actually feel for and feel the understanding of another person. And I think that is key and has been key in looking at the education system, not just in Ireland, but around the world for children, our capacity to really understand where they're coming from and their own capacity to understand where they are coming from and others. And the last one may seem a bit unusual in some ways, but I think is really equally relevant, is children's own agency and young people's own agency to be civic actors and to be civically engaged. And there are loads of examples of how young people who are civically engaged within their school system do better. And I'll come back to that too. So next slide, please. So whether, no matter what way one looks at well-being and the context of well-being, we have to remember that it's really everybody's business, right down to a child, a parent, a family, right through all the socio-ecological system. And the meso system, which includes a neighborhood, school and home, as well as religious settings, I think is a key one. But it goes right out to chronosystems, including policy and societal structure. It's not by any coincidence that we know that young people whose well-being is poorest in schools are those who are least supported in schools or whose involvement in their school is weak. So it's not, that's not unusual or rocket science to work that out. So really it's about all the actors from government right through to individuals and communities, everything operating in concert that enables better well-being. And just to be really clear, when we look at well-being, we're talking about well-being as something that really is about relationships, because relationships is the total determinant of one's well-being, whether that's familial relationships, school relationships, community relationships, hobby relationships, relationships with one's religion and religiosity, or right out as far as societal relationships. These are the playing pitch for understanding how well-being operates. Well-being is not a static entity, but very much a vibrant entity for any young person. So, we've all heard the saying, it takes a village to raise a child, which is an African proverb. And that's very true. So it's about this collective effort. But there's also a Chinese proverb that you can sit on top of a mountain, but you can't sit on top of a pin. And it's all very well for people who are in comfortable positions to think about well-being, but think about that in the life of a parent or parents who are struggling to have enough for their children to go to school, or for a child for whom school is not a good experience. And And I certainly, you know, I reflect back on my own childhood, which is not today or yesterday, but I certainly went to a school system that was not a healthy system. And in fact, it was like a form of prison in terms of corporal punishment, in terms of bad culture. So I can identify very quickly with young people who are struggling in school, maybe in relation to being bullied by peers or something. But just, it really is important that we understand that well-being is a real life experience for somebody. It's not a fictional theory. It's your daily experience. It's your Monday to Friday experience in the school system. So the chrono system is something that I would highlight as very important, because that is the overarching system. So we know it's very logical to think about the fact that if you have an education system that is well supported, you have a principal and teachers in a school who are well supported, they're better positioned then to support the children they work with, and better positioned to really engage with parents of those children as partners in the education of the child. Next slide, please. So this is a famous photograph that actually won an amazing award. Was taken by a child with a parent, but actually taken by a child, believe it or not, on a mobile phone in India. And it just shows about the adaptability. So the reason I have that there is that the irony is, despite the fact that you can have really good education systems, there are still some young people for whom their well-being may not be great. And ironically, you also can have very poor education systems where the child, the family, the school even adapt and use their own agency to enable better well-being for children. So you have this very diverse, ironic set of conditions that even with the best will in the world, it doesn't necessarily guarantee, a good school system doesn't in itself guarantee better well-being. So we need to be careful about understanding well-being in that way. And I particularly cite the work of my colleague here in NUI Galway, Professor Saoirse Gowan, and the team that have done amazing study over many years on healthy schools and behaviour studies, which really reinforces that point. But of course, the key thing is that what you want is the best of both worlds. You want a good school education system that is married with children, families, school staff that are adaptable and can use their own agency to create a good community. I was taken by, I will talk a little bit about this later in relation to empathy education, but I was very taken, for example, by the way that a school not far from where I'm from, originally in Dublin, O'Connell School, uses where the principal uses drinking chocolate as a well-being tool for young people in the school. And I was really impressed by how the principal did that. And what she did was she enabled young people to say that they needed a cup of drinking chocolate, which was code for "I need to talk to you." It's a simple example of how you can get good well-being going in a very discreet way in a school, apart from the fact that the joy of a cup of drinking chocolate is something nice to think about going into the winter. But it's a way of maintaining a child or young person's well-being when they need support. So you've got this balance between really good systems, which we want there, well-funded schools, properly resourced with enough support teachers and so forth, and conditions in terms of physical conditions in the school. But then you also want to encourage the individual agency of a young person to adapt to the stresses that life brings on us, or can bring on a child or a family. Next slide, please. I'm raising this STEM question here on well-being. So I think this is something that really needs to be debunked. So the concentration on PISA scores in the education system and the concentration on STEM subjects, I mean, you know, I don't need to rehearse, we're all very well aware of that. But I would argue very strongly that actually there is growing evidence, particularly from neuroscience, and I'm not a neuroscientist, nor do I wish to be, with due respect to neuroscientists, but there's growing evidence from neuroscience that actually where you have things like empathy education in schools, and you have well-being, active well-being programs and education in schools, actually young people's education, they do better. They actually do better in their attainment of academic knowledge and skills. So even if one is a complete skeptic about the importance of well-being education and well-being practice in a school and empathy education in a school, even if one is a skeptic around that, and really a school is only focused on performance, and I think the issues of schools being under pressure about exam results is well known in this country. Even if that's the case, believe it or not, actually, if you put well-being in place in schools and empathy education, you'll get better academic results. But that's the last reason for which one should do that. And in fairness to many of the schools that I've worked with and teachers and principals, as well as non-formal education sectors like Feroiga, they're very well aware of the fact that actually it shouldn't just be around STEM subjects or academic achievement. Next slide, please. So I thought this is really interesting study from the Economic Social Research Council in the UK. So they completed a 25-year study on reciprocal well-being effect on education. And they had three very, very significant findings. Now, this was a 25-year tracking study, so it's pretty long-term, pretty solid evidence, and informative and so forth. So first of all, they found that high levels of education are associated with positive outcomes. That includes better health and well-being and social trust. And social trust was something that I was very interested in. So social trust was in terms of the trust that a young person had in their teachers, the trust and safety they felt in coming to their school, the trust they had with their peer group, as an important aspect of their personal well-being. So what they found was that health and well-being, including mental health and well-being, improved. There was a positive track between higher levels of education attainment associated with positive outcomes, which I mentioned earlier. Now, we've got to be careful around that finding because it's not saying that it's a causal relationship. So we don't know if you do better in school, that causes you to have better well-being and mental health, or whether because you have better mental health and well-being, it causes you to do better in your education achievement. But what we do know is there is an associated relationship. So that's an important finding, I think. The second finding is really equally important, is that this education effect is robust, it's stable, it stays good over time. It's not a flash in the pan for whatever way you want to think about that. Its social trust became stronger as children grew in terms of their education achievement. So that's a really important second finding. And the third one found that people who reported satisfaction with their education level, young people and children and youth who reported better levels with their satisfaction with their education level, this formed better part of their personal identity. And personal identity is really important. And I often describe personal identity as name, place, and value. Who you are, where you're from, and that's not just geographically where you're from, and how you are valued and how you value others. So there's a very positive psychological benefit in well-being as part of education systems. And that's not just around well-being as a subject, and we're going to hear more about great examples of well-being as part of education curriculum, but it's about well-being as a practice as well. And as I say, a 25-year track record is, I think, very impressive. Next slide, please. So the kind of founding father, for want of a better term, of resilience is Michael Rutte's work, which goes back over decades. And one hardly sees a journal paper on the topic of childhood resilience without seeing a reference to Michael Rutte's brilliant both pioneering and long-term work. And As far back as 1987, which is not today or yesterday, it's over 30 years ago, he identified 4 techniques to help children be resilient and to improve their well-being or well-becoming, which I think is a lovely way of thinking about an alternative to the word well-being, well-becoming. And he would argue that this, has argued very strongly, that this is implications for school systems. So he's saying there are 4 techniques that you can use to enhance well-being in school systems and in non-formal education systems as well. So the first one is to reduce risk impact. So that's where young people, children or youth, may experience risk or even in some cases harm, is to work on reducing the impact of the harm. And that's really interesting if you think about that, how a school system can support, in terms of basic social support provision, can support young people. The second one is to reduce a negative chain reaction. And I'm going to give a really good example of that in a moment. But what he means by that is just because one thing goes wrong in the day for a young person, everything doesn't have to go wrong. And that can be as petty as an issue over a uniform for a young person, or not having a uniform or something like that in school, or not being prepared for the day and things going downhill continuously for the day or for the week, is to try and stop or reduce the negative flow. And that's a really important cultural question around social and emotional learning for children and young people in school systems. The third one is to promote self-esteem and self-efficacy. So that's both belief in yourself and belief in your capacity to overcome your own challenges in life. And the last one is to provide opportunities. And that's where I think civic engagement, which I'm going to come to again in a moment, is really important, because there's a load of evidence that shows where young people are civic actors in their schools or in their communities, the benefits to them are massive. It actually outweighs in many ways the benefit of their support provision to others, the enhancement that they get for themselves. And there's a lot of evidence to support that. So next slide, please. So the other way to think about resilience is the 5 R's. And these are really important from the perspective of enabling well-being in schools. So the first one is responsiveness. That is responsive to the individual need of a child, responsive to the school system in terms of what the school system needs in order to thrive. Relationships, which I've highlighted, are crucial. In fact, for any one of us here today, think about the importance of how important relationships have been to us during lockdown. Even the fact of not being able to see people and how we worried about that in terms of our relationships. So relationships for young people in school, both relationships with the teacher, peers, and other actors in school systems, right out to obviously the importance of their familial relationship is key. So relationship is the second R. Reciprocity, which is again connected to civic engagement. Reciprocity is not to think of young people in schools as just recipients of the support that they get in schools, but also of actors who can contribute. And there are loads of examples in schools, from green flags and all sorts of initiatives now in schools that give young people the opportunity. I would argue very strongly, very strongly, that reciprocity should be heightened, or should be in a way advanced as much as possible for young people who are most on the margins in the school. That the very young people who you would least think of in a school as actors supporting others are the very ones that schools should reach out to for all the good reasons. So in a way, it's kind of a form of emotional upgrading. That can be challenging for schools to think about doing that, but actually the benefits of it are quite strong. And then we need to really remember the importance of ritual and routine in daily life in school. The ritual of getting ready for Christmas, Easter, Halloween, all those things are really important for young people's well-being, because young people in schools, young people always want to have a future event to look forward to, as do adults. And the importance of routine in school cannot be underestimated, because it's predictability. And if you can predict what's in your life, it's much easier to be resilient. So I'm going to get very real about this. A colleague here, Bernadine Brady, a colleague of mine here in our centre, we've got this thing going where we're getting into podcasts. It was one of the things in lockdown when we were allowed to go our 5K walking that I certainly got into. And there's a podcast called The Witness. It's on Spotify and wherever you get your podcasts, as they say. And I don't want to give it away, but it's the story of a young man called Joey O'Callaghan from Dublin, who's originally from Ballymun. And it's the first episode alone is one of the greatest examples of how well-being in education is so crucial. And I don't want to give away the story, because it's a 10-part series. It's absolutely fantastic, and he's an amazing person. But the reason I'm highlighting it is, and this is the one bit I will give away, is that one instant in the school where he went from positive well-being to very negative well-being, both personally and in his relationship with others. And lack of relationship led to other things that happen, a particular event. So if you listen to, even if you listen to the first episode, it's a great way of understanding, unfortunately, in a negative context, how important well-being and education, and how connected well-being is to education. Next slide, please. So myself and colleague, fellow UNESCO chair Mark Brennan from Penn State University, in 2017, the UN Youth Office asked us to write the program on child-youth civic engagement through both formal and non-formal education. This is about connecting home, school, and community, and how those interplay. And we uncovered 4 key forms of civic engagement for children that are crucial to well-being. The first one is political, which is the one that most people think of. But the second one is ethical, which is almost like moral civic engagement. And young people have a great sense of social justice. And ironically, sometimes we don't actually afford them the opportunity to to really voice their ethical considerations on things that they know are right or wrong in life. Social civic engagement is very obvious. It's about social engagement with others. There are great examples, for example, during lockdown, how Foróige young people went and supported older people in their local community, or the GAA. Great examples of social civic engagement, which enhanced the well-being, of course, of the young people who did that. And the last one is economic, which is totally obvious that all the things that I'm talking about today, poverty is a huge issue for young people. And poverty is one thing that does disable well-being. And poverty for schools that are trying to deal with so many issues alone as an issue, poverty is a major challenge. Next slide, please. My colleagues here in the UNESCO Child and Family Research Centre, being led by Dr. Tanya Kovacic and Dr. Cormac Forkin, and I've worked with them on the group, we've just finished a really interesting piece of research for Rethink Ireland in relation to looking at equity in education and alternative form of education. And we worked with many NGOs around the country who are just doing such incredible work in terms of the evaluation. And these ranged from things like iSchool, which was homeschooling, right through the Cork Life Centre, which is a fantastic alternative education model, right through Trinity College, which has an incredible programme for people living with disability and their right to education. But one thing that really came across from the research, which I've grouped together here, is taking well-being in mind, is that there were 5 key ingredients, like 5 Jamie Oliver parts of the recipe that really were common brilliantly across the interventions that really support well-being. And they're so obvious, you might say, Pat, that's stupid, but the fact that they're obvious is all the more reason that we value them. The first one is friendship or being friendly, less formal. And that's a really key part of a relationship. And that's a challenge for school, because I know teachers on one hand have to be the teacher, but in another way, the school has to be a friendly place. Caring, which is one I would highlight, which really relates to empathy, is to try and have less hierarchical relationships where you can, and provide opportunity for developing trust. And we saw how important social trust was earlier. Wraparound approach, which brings together students, families, community partners, that gets you better mental health. Working together, in not, the term now is co-production, but actually working together, particularly with young people who experience disadvantage and their families, is really crucial and really does impact on well-being. And the last one has really been practical. And the practical thing they said was just the basics of a young person having a space that at home, or a space that they can actually get into a study routine and enable their own work ethic. It's really interesting. We, in a different study that I'm just completing with UNESCO, it's a global study using youth researchers on the impact of COVID-19 on youth. And it's studies ranging, there's 96 countries involved in the study, so it's a lot of work. But one thing that has come up a lot has been the fact that for young people online, one of the reasons they didn't want to go online in their education was because they didn't want people to see that they didn't have the greatest conditions that they were living in. It was as simple as that. It was nothing else. It was such a basic practical thing. So being practical is the last one that I would really highlight. Next slide, please. So I'd recommend that you have a look at that report, which I'm very happy to share with you, and I'm sure the Children's Rights Alliance will with Tanya and company will share as well. So bringing this together a bit and bringing it to a close, I'm arguing that there is a relationship between empathy education and well-being, and I'm on a mission to, we've been working here for the last number of years on developing a model of empathy education for secondary schools. Mary Gordon's very famous Roots of Empathy program is well known, and Bernardo's have been brilliant in pioneering Roots of Empathy. I'm working very solidly on developing an empathy education for secondary schools, and receiving great support in that, because there's a huge relationship between your well-being and your empathy. And we can think of famous political leaders around the world where there's nothing wrong with their well-being, but they don't have any empathy. So we need to make sure that you have empathy and education and well-being education tied together. And so I'm saying it's all about relationships, and that's key. The one example of bringing those worlds together of non-formal and formal is a program funded by Rethink Ireland again, where we've been doing the evaluation work in collaboration with Froiga of Bridging Worlds. My colleague, Dr. Cornelia Connolly here, has been leading on the research. Bridging Worlds is where we bridge between formal education and non-formal education. And it's using things like arts, music and literature and even sport, bringing that into the school system more. And they're great examples, other examples of that. But they're channels for both empathy creation and better well-being. Certainly when I went to school, unless you were very good at sport and very good academically, there's no other way that you could be famous in your school. Now, thankfully, we're beginning to think of young people who are decent people getting a bit of fame for being a decent person as a way of getting good recognition in school. So it's all about bridging the formal and non-formal, I think is a key way of enabling well-being. Next slide, please. So I recommend you look up that as well, that program, Bridging Worlds. So in bringing together well-being, resilience, and empathy and civic engagement, I look on well-being as something that's inside of us. Our well-being is almost like a glow inside of us, and we get that glow from our relationships. Our resilience is both our own stickability, our own ego drive, but it's also the outside social support that we get that enable us to overcome the odds. And I think empathy and civic engagement are the tools we use to navigate our well-being and our resilience. And they're the between one. It's the inside and outside and between. I think that's a kind of a unique way of looking at that. Next slide, please. So finally, to finish, I've been very honored. I'm about to go, COVID willing, to the US after Christmas to work with the Fred Rogers Center in the US on a Fulbright, looking at empathy and how empathy can be enhanced into well-being and into well-being education. And Fred Rogers was an amazing man. There is a movie with Tom Hanks out, which you may or may not see, or you can see, of course, called Mr. Rogers' Neighborhood. And then there's also a brilliant documentary, Won't You Be My Neighbor? So Fred Rogers was the pre-runner to Sesame Street. He was an early childhood educator. He was advised on his programs by Margaret McFarlane and Eric Erickson, but he was an absolute genius because he connected education and empathy and well-being together long before others have heard of it. So I would strongly recommend that you consider that look up Fred Rogers if you don't know it already. But I would leave you with the words he talked about. The key to education is humanity, and I think that is a great lesson for us all. Thank you very much.
Thank you very much, Pat. That was really inspiring and so interesting, and there's so much content. So I would really encourage all of you listening to put in your questions to the question function, because we are going to have a panel discussion after our next speaker, who I'm delighted to introduce, who is Deirdre McHugh, who's an educational psychologist and is the regional director of the National Educational Psychology Service, and is going to speak to us about the government's wellbeing framework. And I think this will hopefully highlight what is being done to really help children and young people in the school context, and indeed teachers. So over to you, Deirdre.
Thanks, Suzanne. Can you hear me okay? Yeah?
Yeah, that's fine.
Good. I'm using two screens here, so I'm going over and back. So thank you to Pat. Thanks for a lovely introduction to what I'm going to be talking about here today in relation to the department's approach to wellbeing. So I'm going to kind of start by talking about the wellbeing policy that was alluded to there, and then talk about the whole school approach to wellbeing, but then drill down into some of the more practice-based work that we have planned for the next academic year. And I will talk to the work of NEPS, but also the work of other sections and services working in the department here as well. So just for those who maybe are not as familiar with the wellbeing policy, this policy was launched back in 2018 by Minister Bruton. It was launched to provide really, or put together to provide an overarching framework for schools to promote the wellbeing of all members of the school community. And it was to ensure that the approach the department took was in line with best practice, and also to bring better cohesion to the existing system. There's a lot of really good work that goes on out there in schools that was mentioned there, some examples there. Practice has been going on for years. It's about bringing that together and bringing the work of all the separate agencies and services together so that we come out of our silos and begin to ensure that there's better cohesion to that work. And also to facilitate intra-departmental and interdepartmental coordination across wellbeing promotion as well, because we know this is really important to the HSE services and other government departments as well. So just to broadly outline the approach we're taking, I won't go into all this in detail, and I know you've been more interested in the practice as such, but just to say that the department have now established a Wellbeing Office, which is the first time that we have done this, and it's in NEPS, the National Educational Psychology Service. And this office coordinates the wellbeing related matters of the department. So we deal with the correspondence and any issues arising from internally and externally in relation to that work. So a wellbeing steering committee has been set up, and also an implementation management group. So the steering committee kind of coordinates and oversees the implementation of the wellbeing policy, and the implementation group, which I chair then, supports that work. And membership is drawn from the relevant sections of the department, and the steering committee is chaired by the Assistant Secretary, Martina Mannion, who then feeds back progress on the implementation of the policy to the Minister on a quarterly basis as well. And then we have an interagency group that's chaired by NEPS as well, and we have representation from department agencies and services who are involved in this area of work. So it's a forum for sharing information, ensuring good communication and clear, consistent messages to the school system. And we try to identify gaps and duplication of work practices. So for instance, we've now put together a catalogue of resources and CPD directories to ensure that schools have, easy access to this information, and also to work to reduce that duplication as mentioned. So we have services like the Professional Development Service for teachers, junior cycle teachers, the NCCA in charge of the curriculum elements of the work, the NGCE, which links with the guidance counsellors, NEPS, the NCSE for National Council for Special Education, and also involved are the HSE health promotion staff as well, who've worked in schools for many years, doing fantastic work that we are now kind of aligning to. And I know that NUI Galway there, for where Pat's from, have done a huge amount of work in this area over the years. And have linked with us, and we met Saoirse, who you mentioned there, Pat, over the years, and hopefully building the good research and practice that they have been doing in Galway. So we're also now in the progress in a wellbeing advisory group. So we want to convene this group to involve key stakeholders to help with this work over the years to come. So the policy, just to mention, starting more broadly, looks at a whole school approach to wellbeing. And it looks at these 4 areas here in particular, the first being culture and environment, the importance as fostering kind of warm, caring, social, physical environment where everybody is valued in the school community. And I, for one, who have visited schools over the last 25 years, can tell you that the minute you walk in that door, as many of you have done, maybe as parents or support staff, you really get a good sense of the culture and ethos for the minute you walk through the door, from the greeting you get to the space you'll be brought to, whether you get a cup of tea or not. And that's the same for children every day of the week. The curriculum, the teaching and learning, is just one element, but as Pat maybe mentioned, it's a real focus for many schools, a very important element, but that it's also a bit larger than just the teacher and learning, but important that the SPHE curriculum would be placed here, but also that not only does the SPHE curriculum and teach social emotional competence, this happens every day in every subject, and how do we integrate wellbeing into the teaching and learning throughout the day in every school. Then policy and planning, developing and implementing policies which are monitored and reviewed, and that wellbeing is referenced in all policies. Schools are not asked to have a separate policy for wellbeing. It's really integral to everything that they do. And most importantly, again, as referenced, relationships and partnership are absolutely key. The role of the teacher reaching beyond the teaching and learning, having that chat, the hot chocolate, a cup of tea to ensure everything is okay, ensuring that the child and young person feels safe and secure, that the children have access to that one good adult that can guide young people through their vulnerable times. And it was mentioned there that the podcast, what came to mind when you mentioned the podcast that from Joey O'Callaghan was some work that we do with schools using Ian Wright as a good example, the footballer who talked about a teacher who really took him under his wings and gave him direction and purpose in his life. And there's a lovely podcast out there that we often use with teachers to emphasize the important role that they play in that relationship space with the students that they teach. Also the importance of relationships with parents and also partners external to the school, which is key as well. So the policy recognises importance of risk and protective factors, and that wellbeing is connected to the wider world as well, ensuring that the schools know, and part of the training I'll come to, that teachers are aware that poverty and inequality and discrimination, oppression are major risk factors in young people's lives as well. Just also to mention that the research of the policy really refers to preventative and universal targeted approaches, and the importance that research indicates that the whole school approach should recognise that individual children and young people can have different needs at different times, and those at greater risk with a greater need may need more specific and targeted support to be provided. In addition to that at a universal level. So a child with high levels of anxiety at home and school may need one-to-one support outside of the classroom through the work of a teacher who has been trained in this area, whether it be a guidance counsellor or a teacher for kids with social emotional behavioural needs, in addition to what the classroom teacher, the subject teacher, can offer in the classroom. And this is in line with the department's continuum support, familiar to all schools already. And the policy also includes statements of effective practice. These are key reference tools to standardise the approach to wellbeing promotion in school, to ensure that the needs of all, some and few are attended to. So guidelines and tools have been developed to support schools to engage in this wellbeing promotion process, and these will be available on a new wellbeing and education platform on the gov.ie site to be launched very shortly, and provide a good roadmap of the resources and supports available. And the resources are for students, school staff and parents, and they include things like questionnaires for students. I'll just move to that next slide. So questionnaires for parents, for learners and staff to use as part of that process of gathering information to include the voice of the child in that engagement. Focus group guidelines, again, used with young people, parents and staff. Indicators of success, the online catalogue of resources and directories of CPDs that will be available to support this work that will all be on the gov.ie site. And then in order to assist the department in planning for the needs, the professional development needs of schools, what we did is we put an action research project in place in 2019 involving 30 schools. That was 10 post-primary, 19 primary and 1 special school. And this was led by the Professional Development Service for Teachers in collaboration with NEPS and the JCT, the Junior Cycle Teachers, and involved training and support to the school. And NEPS then evaluated that work and to check to see how the policy statement and framework for practice was implemented in schools, how the schools engaged with these resources I mentioned, how they were engaged with the training and the support offered to them. And then the findings of this has now influenced a planned rollout of CBT starting this November. So just to say some words about that. So this rollout will be on a phased basis over the next 3 years. And so starting November 2021 to March will be the primary rollout, and then post-primary from November through to, to January 2022. And it's in conjunction with the Education Centre networks. And a principal plus a member of school staff will come out of school to receive this training from the Professional Development Support Service at PTSD. And then they'll be supported on return to school with webinars to share with schools, but also sustained visits to assist this work. And this work will walk through with the school staff their understanding of wellbeing, the school risk and protective factors, and how they can support the wellbeing through the structures and supports that they can put in place in the school, emphasising the importance of those 4 areas of wellbeing promotion: culture and environment, teaching and learning, relationships and policy and practice. So who's involved? Everybody really, as with most whole school approaches, the whole school community, which involves all stakeholders, parents, students, board of management staff. That may include the bus escorts and the bus driver for children who attend special schools. It may include caretakers and secretaries, SNAs. And a dedicated team will be involved in supporting this work, because wellbeing promotion is not the responsibility of just the principal, it's responsibility for everybody in the school community as well. So schools are asked to include wellbeing promotion as a focus for their school self-evaluation by 2025. This was 2023, but because due to COVID extended, because we have been delayed, the action research project was delayed because it cut short in March due to the school closures, so we had to extend the time frame. We're also reminding schools, again, as I said, they don't need a separate policy in place. It's really that wellbeing is integral to everything they do within the school community. So then just to talk about the practice and more generally and what is offered here, that NEPS casework, and they offer casework to schools and support and development work. So the casework service involves the provision of a psychological service for students, and the psychologist works with students and teachers and parents and other professionals, if appropriate, to identify the needs and plan for interventions to support students. And each year we extend the service to approximately 8,000 students per annum. Of these students, approximately 30% are prioritised to NEPS due to social, emotional, behavioural needs, mental health issues as well. And when providing this service for our students, NEPS works within the existing school structures to support the provision of therapeutically informed practice appropriate to the education system to support participation, inclusion and well-being. And the other 70% of the requests for involvement are due to learning cognition needs or communication interaction needs. And the work is either direct or indirect. We can work with students directly, with parents and teachers, observing in the classroom, working directly with the child, or we may also do this indirectly by working mainly with the parent and teacher to give generic advice in a more preventative capacity. We also then offer support and development work, and this service reaches approximately 25,000 teachers annually, and it's applied psychological service for staff to build capacity and respond to wellbeing, academic, social, emotional and learning needs of students. And in this service, I'm just going to outline what it involves. So it builds capacity, it supports the provision of therapeutically informed practice and responses in schools. And I'll outline some examples of what we're doing this year. This is not does not include everything. Schools can request support from their NEP psychologists bespoke to the needs of that particular school, and we can tailor their training and supports depending on what is required. But to mention first the Friends for Life training, and this is evidence-based anxiety prevention and resilience building programme offered at primary and post-primary, and fosters self-concept and a sense of belonging using cognitive behavioural therapeutically informed tools in schools. And to date, 6,500 teachers in primary and post-primary have been trained by NEP psychologists to use this programme. And teachers are well placed from the research we've done to deliver this in school over 10 sessions as part of the social personal health education curriculum offered to schools. So we've now adapted this for webinar format. We've also offering the Incredible Years Teacher Classroom Management Programme, which is a 6-day evidence-based programme that equips teachers to manage the classroom effectively to prevent and reduce behavioural problems while promoting children's wellbeing and emotional social competence. Evaluation has been carried out extensively and indicates the programme is really highly effective by teachers, with over 90% of teachers noting improvement in their classroom, increasing teacher self-efficacy, reducing stress and increasing teacher wellbeing, as well as improving behaviour. So this is now available, refresher training is available online this academic year. Also, what we're offering at the moment, and have been offering in the past, but is work in relation to student support teams. So a student support team is a central part of the student support system in a post-primary school, and it's an overarching team concerned with progressing the actions and welfare of the wellbeing of all students, and it's a mechanism through which many of the assistance supports are coordinated and planned. It's the kind of the hub in the school, bringing coherence to the support system, coordinating the valuable work of the guidance counsellors, the SEN teams, pastoral teams in the school. And through a pilot project in Donegal, Cork and Dublin over the last number of years, we have now reproduced and revised guidelines for schools that are ready for distribution and will be sent to schools in the coming month. And that will support schools in reviewing their systems of support, and their NEP psychologists will be available to support them with this by providing training, carrying out observations of the team, evaluating their work, sitting in the team, offering advice and support if required. So this is, as I said, an ongoing piece which will continue over the next academic year. Also, we are progressing wellbeing and resilience in schools webinars. These are a series of webinars, and the part one, the stress factor, getting the balance right, will be available in October, November this academic year. And these include trauma-informed approaches based on the principles of cognitive behavioural therapy and attachment aware, really emphasising, as Pat mentioned, the importance of relationships in schools. And it's very much based on neuroscience that he mentioned as well, the work of neuroscientists in relation to how the brain functions, how it affects development in the early years, and the importance of helping children build resilience and regulate themselves in relation to what happens to them in their life, and helping teachers understand and support them in this work. So following a pilot of this work last year in schools, in JESH and non-JESH schools, this work will be released shortly, and then further interest modules will develop the content in more detail. And there's 4 in total on the topic of adversity and trauma, attachment, self-regulation, and self-efficacy and hope. The workshops will be available to all school staff, primary, post-primary and special schools, and the work will be available on a new learning management system platform to be launched in October by the department. And then NEP psychologists will support this work in their visits to school and support the implementation and practice. And then finally, as an example, a new e-learning course is also now going to be available in relation to critical incidents. NEPs would have been involved in this training in schools over the last a long number of years and respond to incidents when they arise. So this training will highlight the importance of preparedness and planning should a critical incident occur in the school, and help schools plan, as it can be so overwhelming when an incident happens, whether it's a road traffic accident, a bus accident, or unfortunately suicide, or some tragic deaths within the school community. Supporting staff and students and parents are key to promoting resilience and wellbeing and coping with that particular trauma. So there are many other supports in the department as well, and particularly provided by the Professional Development Service for teachers. And they have health and wellbeing teams who provide curricular supports to schools in relation to SPHE, the Stay Safe programme, RSE, anti-bullying, and restorative practice. And again, a post-primary in the area of RSE, mental health seminars, substance abuse, child protection, and PE. And JCT, the junior cycle teachers, as well offer curricular supports in the area of wellbeing at the junior cycle end of the school. Supports for school leaders are offered as well through various Mishnah, Tanishta programs, and wellbeing is threaded through these programs to support middle leaders and principals and deputy principals in their work. We also work closely with the HSE Health Promotion team, and for instance, they will be continuing to offer the SIPPy's Friends programs, healthy eating programs, and support and active physical activity programs in schools in the coming academic year, and that is supported by substitution covered by teacher education section of the department. We also work closely with the Department of Health, and this has been a big piece of work over COVID, because the department has built strong relationships with them, and we're exploring ways to improve supports for young people, especially around awareness raising, promoting health seeking behaviour, and signposting to the wider range of available services that are out there. And the HSE, as you're probably aware, are funding e-mental health services at the moment as well, and also provide support to NGOs, which we're working to signpost in schools through the work that we do, and that NEP staff, principals, school support teachers, and student support teams will be signposting to these supports when appropriate. And then lastly, just to finish off, just to mention that school staff wellbeing is essential to the wellbeing of our students. We often use the analogy that our teachers need to put their own oxygen mask on. If they were on a flight and there's an accident, you'd pull down your own oxygen mask before you and support your students. And that they need to engage in preventative approaches to mind their wellbeing to support those in the school community. So Spectrum Life, this is the EAS, the Employment Assistance Service for all school staff that is available to support the school community. And they also work preventatively with principals and deputies, offering seminars and support in relation to their own mental health to support this work. And it's a 24/7 supported service that's available to their families as well. And more information is available on the Wellbeing Together website. So hopefully I've covered quite a lot in a short period of time. So happy to take any questions through the chat button. Thanks.
Thank you very much. Thank you very much. That was a really comprehensive outline of all that's available to the school system, really, from the National Educational Psychological Service. So I'm really pleased to say, I don't know, Pat, whether you want to put your camera back on as well, but I'm really pleased to say that we have some questions. So what I do while I'm waiting for Pat, oh, Pat's there, great, hi Pat. What I'm going to just start with, I suppose, the question that's just come in, which I think is key because it reminds us of the context we're in, really. So it's just reminding us of how much children have been impacted, if you like, by COVID, and some children more than others. So I suppose this question is directed at that. So what needs to be done, really, to support children who've really been impacted by the COVID context to catch up, both educationally, socially, emotionally, and also it might not just be about missing school, but children might have suffered in other ways too. There might have been the death of a loved one. There might be massive strain in the family. So they're coming to school with all of that as well. So there are two aspects to be considered. So I don't know which of you would like to answer that first.
Well, maybe Deirdre, if you want to go first, I'll go second. I don't mind. Do you want to?
Yeah, there was probably two parts to that, Suzanne. Really, it was about the COVID impact. Is that the first question? Yes. And what schools can do to support on return, is that correct?
Exactly.
Yeah.
And the second was just about general support in recognising that children come to school with whatever's happened in their lives as well.
Yeah. And I suppose part of the work that we would be doing with school staff and teachers, building that capacity to help them understand that, yeah, children are arriving to school with, suppose, maybe sometimes a load on their shoulder. We don't know what happened the morning before they come. Did they have breakfast? You know, how are they feeling? And to be able to work with teachers to help them understand that behaviour is a form of communication, and that we need to understand what they're communicating through maybe the behaviour that they see. So the behaviour may be acting out, kind of more maybe aggressive behaviour, and they need to understand that so that they understand what's going on in that child's life. So it's part of the work that's really important with the support and development service that we do to build their capacity, because the teachers are key. They're with the children all day, every day. And that relationship that Pat mentioned is key to that. So helping them understand what's going on in a child's life, to be able to help them to feel safe and secure, those key ingredients that were mentioned, the safety and security, particularly after COVID, where their lives were turned upside down. They were at home 24/7. Some of them had access to technology and were able to access teaching and learning online. Some were not. Depending on their age, that was very difficult, and depending on their special educational need, depending on, you know, the technology that we're able to access. Some were left out quite a lot. So therefore, there is that kind of sense that they need to come back to school to be able to get a sense of belonging and security and safety. And going back to what Pat said, that routine is really very important and develop the protective factors in school, and that gives them security to be with their friends and to learn again. So that cannot be underestimated, just that sense of normalcy, because many children have coped quite well, thankfully. The majority of children will have managed, depending on how maybe often their adults have coped with at home. And we need to reassure them and build a resilience to say that if they were not coping and they were struggling, that was normal as well, and trying to reinforce the fact that there was a certain amount of normality. We all struggled through the last 18 months in various ways. And life, as mentioned, wellbeing is a journey and it's fluid, and there will be ups and downs, and that with the support of their school community and their parents, hopefully they will get back on the right path again. That might answer some elements. Pat might want to come in and comment on that as well.
You know, I think that's brilliant, Deirdre. I mean, actually, it's interesting. I think, first of all, I think there's been huge variability. The evidence is we're just finishing a HRB study on the impact on basically the impairment of education during COVID for marginalised children and youth. And so it's interesting, there are a few things coming up. One thing is that actually for some young people who are on the margins, believe it or not, COVID actually wasn't a bad thing. This may seem like a bit of a shock. There are some young people who are saying, well, actually, I wasn't physically bullied because I wasn't physically in the presence that I could be physically bullied. Now, I may have been emotionally, you know, so there's really quite, there, you know, and I think there are some, so I think there's variability on the experience of COVID that we don't have enough knowledge of. Now, of course, there are young people, let's be straight about it, who are living in domestic violence situations, who were locked in, which is really dangerous for their safety during COVID. So, you know, there's a whole range of things going on here. But in terms of solutions, I would agree fully with what Deirdre said. The other thing I would say is for some young people, you know, just learning online was not really working for them, and they just checked out. So really just the first thing is to get them engaged back in to being in the mode of education. And I think for schools, again, relationships are key, but breaking that down into very biteable, manageable bits, nearly on a daily basis, nearly on an hourly basis for some young people, in order for them to engage back in. And in terms of trauma, which is definitely there for some young people, and as you quite rightfully said, Suzanne, there are young people who have lost loved ones during COVID and couldn't even go through the normal grieving process that we normally have. I lost a brother during COVID, and only 10 people could go to the funeral. So I can identify with this. So I think it's a very gentle approach to this. A lot of compassion and empathy. I know I'm bringing it up again, but a lot of compassion and empathy needed. But I have to say, teachers are champions at this. They're doing this anyway, and on a daily basis, they're incredible. The resources that they have, and where in a school the relationship with the teacher is strong, it will be strong post-COVID, just as it was strong pre-COVID. And I suppose in a way, I really like the fact that Deirdre heightened the importance of the oxygen mask for teachers. Teachers need support as well with this. So I think teachers maybe need as much additional support as we can give them to help make up that gap.
Yes. I really like that word, gentle. I think we could all do with a bit more gentleness in our lives. And just to the point as well about supporting teachers, I think a lot can be expected of teachers. And I'm just curious, when I look, say, Deirdre, at the range of things that you've highlighted, a teacher might say, well, where will I get the time to do that?
Yeah.
On top of my busy day.
Yeah, and you're quite right. I mean, I'm very mindful, I suppose, in the department throughout that coming back to school with, documents and circulars and information that is sent out, it can be very overwhelming for school principals and management, but also the school teacher. I mean, the time to do wellbeing, we're not talking about, I suppose, a program, we've outlined various programs there that can be integrated into the SPHE curriculum. For example, the Friends IY, the Roots of Empathy that was alluded to earlier as well, a very good program as well that schools can choose to implement. But a lot of what Pat and myself have talked about, I suppose, as well, is part of the everyday interaction and communication in the school, the culture, the environment, the relationship with parents, the connection. I mean, a lot of schools are using Seesaw now and different various platforms as a result of COVID, which can be quite positive. For me as a parent, the communication has improved a lot as a result of that. Okay, it's not face-to-face, but, picking up the phone is required as well. So it's about, I suppose, just that normal interaction, trying to work through the curriculum. The SPHE curriculum is there, the RSE curriculum is there, the wellbeing curriculum at junior cycle. We can use that vehicle to integrate some of the good programs and practices that are there, that it shouldn't be anything additional per se. Okay. There's space for that additional through the resources they get from the department in relation to the kids with additional needs and how that might be implemented. And I understand the class programme that was announced recently by the Minister as well, in relation to how schools can support children with those additional needs as a result of COVID. Those kids who are struggling to come back into school, maybe with strong attachment issues due to being off for so long, those children that maybe Pat alluded to that, maybe were bullied in school and are struggling to get back into a routine again. So the Tusla Educational Support Service and NEP psychologists and school staff would be working with those cases to ensure that they reintegrate back into school, working closely with our HSE partners to ensure that the supports are in place where required to manage that process. So that there's no denying that it is an issue for some children that we need to continue to support throughout, because we're still kind of in the pandemic, hopefully moving out, but that will be an ongoing issue for our school communities.
Okay, and then there was a couple of questions. Sorry, go ahead.
I think Deirdre made a very important point. Like, one of the ways that we know young people can be enabled to be resilient is through what they call, Anne Maston calls, ordinary magic. And ordinary magic is it's a day by day, as they say in French, doucement approach. It's a considered approach, which teachers, and they have a very busy day, and I'm totally respectful of the pressure they're under, but they have that capacity that even sometimes it's as much as a look of understanding that can make all the difference for young people. even not a word. So I'd really highlight the importance of that.
Yeah, absolutely. I think our non-verbal communication with children and young people is crucial. They sense whether we're available to them or not. I'm just conscious of the time now, and there's several questions, but I just want to maybe highlight a few things that I think maybe both of you could comment on. One is the involvement of children and young people in their own well-being, and I know, Pat, you referred to that in your presentation. I didn't see or hear too much of it in yours, Deirdre, but maybe I just missed it. I could have missed it. And then the other thing then is the role of parents and family support, because at the end of the day, while the children do spend a lot of time in the school environment, as I was saying before, they bring whatever is happening within their family to school, and families sometimes do need support. So maybe you could both comment on those things, and then we'll need to wrap up.
I come in first, Pat, on the voice of the child, and then feel free to follow, because you emphasise that point really well, and the importance of agency. And for us, Suzanne, when we look at the 4 areas of wellbeing promotion within the school, what we want schools to be able to do is cast the net out first to look at what area to focus on and which of the 4. And we really want schools to include the voice of the child in that process. So in some schools, they may use focus groups, in some schools, they may use questionnaires. We've developed questionnaires and pilot questionnaires for primary and post-primary children, receive feedback from the children involved, and we've adapted the questionnaires as a result of that, so that they have a voice through some of those methods. Now that's only just one small example. Obviously from schools, they would be using their student council then to progress those actions and involve the children in any actions that are agreed as part of, there's a 6-step process that the school will go through in gathering information and deciding what actions they take, and they are required to put a school improvement plan in place. So part of that process will and should involve parents and students in that process. So that's how we see the voice of the child being integrated within the whole school approach to wellbeing. And in the statements of effective practice that I referred to in the back of our policy, the voice of the child is referenced there, and this is a very important element for teachers to take on board as well. So I don't know if you want to talk further to that, Pat.
Yeah, no, I fully agree with you, Deirdre. And I would, in terms of children's own voice, I think it's very important that it's not just about them having a voice, it's about what we do about what they say. In fact, one of the risks we have, and I say this as a social researcher, is that we're over asking young people their opinion and under delivering on what they actually tell us to do. And we run that risk, not just in education systems, that's everywhere. So I think my point is, and that's why I was raising the civic engagement question, is young people have a concern for their peers. They have a concern for their families themselves. They worry about their own families. They worry about their own education outcomes. They worry about all these things. They're there for them. So one of the best ways of voice in schools is actually to ask young people for their own views, age-appropriate questions about what they think the solutions might be. What are the solutions they might think for... it gets back to Fred Rogers, where he worked with young people, very young people, to give solutions of solutions to problems. Believe it or not, sometimes young people actually are better than boring adults at actually coming up with good ideas. And we shouldn't, in a busy day in a school, getting space for that and getting time for that, I know is a challenge. But even creating that 10 minutes, it creates a great culture, and it's good for well-being. So conversation, relationships, it's the... and the second part was around family support, which is, Suzanne, is a subject that's dear to my heart. I think I couldn't agree with you more that the big issue for parents post-COVID, and I'm thinking of the work that my colleagues, John Canavan and Carmen Devaney are doing here in the centre with Carla McGregor, the biggest thing that seems to be coming up is multiple problems coming at the same time. That parents are under stress. If it's just one thing, I can deal with it. But if it's going back to school, not having enough money on top of other issues. So I think schools that reach out to parents and engage with parents, and as Deirdre quite rightly points out, one of the side benefits of COVID has been better communication between parents and schools, because, an understanding that with lockdown, we had to work together in a different way. So I think keeping those good aspects of parent-teacher, parent-school culture working together will actually have a side effect of supporting parents better.
Thank you. And thank you both very much. And as you said, Pat, and it's true, it's all about the relationships that we have with each other, with children and parents, all with a view to really doing the best we can to ensure the children have a thriving future. So thank you both very much. We're now going to move on to our next panel, and I'm sure the members of this panel, who I'll introduce you to now shortly, will really enjoy referring back in their input to what both Deirdre and Pat contributed. And we will now start. So I'm just waiting for the panelists to put their cameras on. Great. Hello, everyone. Nice to see you. So just to let you, all of those of you who are listening, know that we've asked each of the panelists to talk for about 5 minutes to what they have learned about the impact of COVID on the children, young people and parents with whom they work, and maybe think through about some of the things they would like to see happen in order to ensure that the children, young people and parents they're concerned about thrive. So I'm going to call on our first input person, who is Elena. And Elena is from the Children's Books Ireland organisation. In fact, she's CEO. And just before I forget, actually, please feel free as you're listening to put any Q&As that you would like to ask the panelists to the question content of your link. Okay, over to you, Elena.
Thanks so much, Suzanne. So we're coming from a really particular place, and there's been a bit of reference to the arts and to literature, and literature being a channel for empathy, which I was really glad to hear from Pat. The context in which we're working and our vision really is that every child has the chance to be a reader. And I would argue that reading for pleasure is a really powerful and really simple way to promote well-being in every school. The link between reading for pleasure and well-being has been really clearly made in various ways. And there's a large body of research and growing, both in Ireland and internationally. It was brought to our attention in 2018 when the National Literacy Trust in the UK published a report looking at the link between reading, writing and mental well-being. It was based on their annual literacy survey of over 49,000 children between the ages of 8 and 18. And they looked at how much those children enjoyed reading and writing, how often they did it, what they think about it, how good they think about it, how good they think they are at it. So that concept of self-efficacy. And in short, they gave each child a score around literacy engagement. And those who had higher scores had better mental well-being than their peers who were the least engaged, whatever way you looked at it. So those who were the least engaged were twice as likely to have low levels of mental well-being. And again, it's that issue of causation and correlation, but we know that there is a connection there. Closer to home, we looked at our own growing up in Ireland cohort study, and that showed that older children who read for pleasure have better academic self-confidence and better socio-emotional well-being. So we have a whole database of statistics around well-being that we've started gathering, and I could gladly reel them off for you, but won't. So I thought we'd look, I suppose, more broadly at reading for pleasure and how it positively impacts all sorts of things. I think there's a lot of evidence there around academic achievement, which is a huge factor in all of this. But ultimately, I've tried to boil it down to 4 things, which is the self and identity, empathy with others. So again, I was delighted to see Pat refer so heavily to that, relaxation and regulation, and then bibliotherapy. So starting with the self, reading is really closely linked to increasing our understanding of our own identities and who we are. The NCCA guidelines for junior cycle talk about when children are flourishing, they feel positively about themselves. They're confident about who they are. They see themselves growing into better people. So we work with schools in various ways. One of the things we do is book gifting. And last year we had 400 applications almost for school libraries. There's a huge, huge need for support and a real lack of resources and no government support for libraries at present. So those 400 responses taught us a lot about what it's like in schools at the moment. And one of the big themes that came up over and over again was representation. So the classrooms reflect the richness and diversity of Irish society, but the bookshelves do not. The books are dog-eared, tatty, old, not modern, and the schools, basically books are fighting for a place in the capitation grant along with heating and everything else. So schools are generally relying on donations, charity shop purchases and what they can buy, so donated rather than curated. And what we hear is that it can be really hard for a child to develop, for a school to develop a feeling of inclusion when some children are not represented in the books that are on the shelves. So we've heard a lot around the 20 by 20 initiative, can't see, can't be. The same is true of books. If there is a child in the class who is a traveler who can't see their culture in a book, if there is a child of colour who doesn't see themselves represented in a picture book, if there's a child with a disability who doesn't see a child in a wheelchair ever in a book, you know, that is hugely problematic. And if children read books that depict only one kind of protagonist, it can skew their perceptions of themselves in a negative way. So they feel less value in themselves. They can, you know, their identity is minimized or erased or ignored. So we've just launched a project called Free to Be Me. It's a reading guide with nearly 370 reviews of titles, and we've looked at the Equal Status Act and tried to have as broad a theme as possible. So some, I suppose, visible differences, if you want to put it that way, but we also looked at socioeconomic background, religion, types of families, sexuality, gender. So there's all sorts in here, and what we've tried to cover is, you know, books that are celebratory for the most part, really brilliant picture books that talk about everyone being included, and that are representative of a broad range of identities. So there is a primary school and a secondary school resource pack that goes with that. We've looked at 44 of those books and put in activities for how best to engage with them and start really important conversations. There's also downloadable colouring sheets, so you can choose for those characters to be whatever colour you like, to be wearing whatever they like. And I'll be really speedy going through the rest, Suzanne, because I know we're short for time, but empathy is such a huge, huge thing. And we know, again, from the research, from a sociological perspective, as well as a neurology perspective, there is a huge connection between reading and empathy. This idea of theory of mind, that you can put yourself in someone's shoes. And we often talk about mirrors and windows, you know, a mirror to the self and a window into somebody else's worldview. So again, analysis is showing increased pro-social behavior for people who read for pleasure on a regular basis. So, you know, that's things like helping, sharing, donating, volunteering, lots of connections, particularly between reading fiction and empathy. And that starts with the early years, that kind of book talk of why do you think this person did that? Or how do you think this person felt there? So that you are putting yourself into somebody else's shoes, in a way for children and young people to learn about each other and educate themselves about other worldviews without folks from underrepresented backgrounds bearing the burden of explaining their culture or experience, or feeling othered or lacking a sense of belonging in doing so. Relaxation doesn't need very much explanation, but relaxation and escapism is something that comes up hugely. You know, we, in preparing for this, looking back over reports from the Ombudsman for Children's Office from 2019 and kids in direct provision talking about reading Harry Potter in the toilet because their sister wanted to go to sleep. You know, these are the kind of things we're hearing from schools, that children haven't had space or support during the pandemic oftentimes, and having a book has been a huge support. Sorry, Suzanne, am I well over time?
You are a little bit over time. It's fascinating. If you want to make one quick point and then...
Yeah, and a closing point, joy. It's such a huge thing. Enjoyment is the most important thing. And, you know, from a research point of view, the enjoyment of reading is a prerequisite for any of those other outcomes to be achieved. So in putting books into schools, we've seen faces light up when we come in with a library of books to hand over. And I think that engagement, that last question that you had for our opening panelists, how are we going to get kids to re-engage? Showing them a selection of really exciting books that are visually diverse, that look appealing, that have covers that they want to pick up, bringing the joy and, you know, taking it away from literacy and learning a little bit, will have a huge, huge impact on folks.
Well, thank you very much, Elena. I mean, I love books anyway, but you sell them really, really well as a resource for children, young people, and hopefully their parents as well. So it's now my pleasure to ask Anya to speak for roughly 5 minutes on the impact for children and young people from her perspective of the times we're in.
Yeah, thanks very much, Suzanne. Well, I'm with the National Parents Council Primary, and I suppose over the last 18 months, we've had an unprecedented amount of parents contacting our services in terms of the impact of COVID on their children. For many years now, for about 4 or 5 years, we've been working with St. Patrick Mental Health Services to we develop and implement a training programme for parents that's called Supporting Parents to Support Their Children's Mental Health and Wellbeing. And all of those years, it has been our highest requested course. And I think that speaks volumes, really. It's not about COVID. This is about parents' concern of children's mental health and well-being generally within society and within the primary education sector. It's often seen as I suppose, an older child or a young person's issue, and lots of supports are maybe directed towards post-primary children, and even we see in terms of NEPs, there's certain services that are available there post-primary. But what we've been hearing from parents over the last number of years before COVID, as I said, is that actually the issues being raised at a younger level, that the, mental health and well-being issues are coming in at a younger level, and the supports are just not there for the under 12s. The child and adolescent mental health services are really sadly lacking in the under 12 area, and children are generally finding themselves on long waiting lists where either the issue goes away or it exacerbates to such a degree that it's a critical issue. So it is something that parents have been talking to us a lot about. We did do a survey during June of this year with St. Patrick Mental Health Services, where nearly 2,000 parents replied to the survey. 55% of those parents said that they had concerns about the long-term impact of COVID on the pandemic on their children, and almost 20% of the parents that responded said that their children had received some form of mental health support over the course of the pandemic. So there are really concerning areas there. And last year we also did a series of I suppose mental health and well-being webinars in conjunction with Coleman Nocta for parents, and we had over 7,500 parents attend those webinars, which again was unprecedented for us. So it just highlights the concern that parents have for their children. And I suppose in the National Parents Council, we would see that the education has an opportunity to provide some of the solutions to some of the overburdened services. And we see critical to that is that education and health have to come together and work together. And we've seen how in other jurisdictions, when that happens, that really effective mental health teams working in schools, in clusters of schools, really does make an impact. That happens in actually quite a number of jurisdictions. We're becoming outliers in not having mental health teams within our education system at primary school and secondary school. And I suppose these mental health teams, what they've been shown that they can provide within schools is that they can provide preventative programs, and also for universal prevention within the school, but also targeted for certain groups of children. It supports teachers in their vital role, which both Pat and Deirdre have gone through in terms of the vital role that teachers have in schools, but they do need support in that role. And it also shows early identification of children that need to maybe be referred on to other specialist services, which in effect actually helps not block up the CAM service, because a lot of the work might be being done within the school in the early intervention place, so the CAM service is more able to deal with the more critical issues. But just to close, with an article I was reading the other day by Public Health England that has been written since the COVID pandemic, and it highlighted 8 principles for promoting a whole school approach to mental health well-being. And I thought it was really interesting. And when you look at these 8 principles, all of them have been covered in some way by Pat and Deirdre, and I think it's useful to see it in a kind of scheduled way. So the first and most important principle, they say, which should be at the centre of everything, is leadership and management. And that leadership and management must support and champion efforts to promote emotional health and well-being within the school. The second principle is curriculum teaching and learning that promotes resilience and supports social and emotional learning. The third principle is enabling student voice to influence decision. The fourth principle being staff development to support their own well-being and that of students. The fifth one is identifying need and monitoring impact of interventions. The sixth one is working with parents and carers. The seventh, targeted support and appropriate referral. And the eighth is an ethos and environment that promotes respect and values diversity. And I think that covers everything that we've all been talking about so far this morning, but that's within the UK system where they do have these mental health support teams in schools. And I really think that, we need to bring education and health together in Ireland. And Deirdre's talked, extensively about the supports that are there in for teachers. And they're really welcome, and I know they're really effective and impactful, but teachers also need support of professionals within the school, within the mental health area, to do the early intervention, to support them as teachers in their work, and to also make sure that children who need it can be referred on to services. So I'll close there, and I'm looking forward to the questions. Thank you.
Thanks very much, Anya. And you couldn't have said any better. It is so important that education and health work together, and that teachers get the support they need from a variety of professionals, and more importantly then that children and young people and their parents get it. So thank you. So now it's my pleasure to introduce Patrick Riley, who's a mental health worker with Pavy Point, and Patrick's going to speak to us from his perspective and Pavy Point's perspective.
Thank you very much. And can I just acknowledge the other speakers? I really learned a lot from the presentation and the previous speakers. Yeah, my name is Patrick Riley. I'm a travelling man working in Pavy Point Travel and Roma Centre. And I would like to start by sharing some of my experiences throughout my time in school. I really loved primary school and had a really positive experience. However, my experience in secondary school wasn't positive at all. I didn't have or didn't get the supports that I needed, and I ended up leaving halfway through second year in secondary school. And unfortunately, there would have been other travellers that would have had similar experiences as that, the same. However, I'm now in Maynooth, and the experience that I'm having there has been so different because of how I was made feel welcome and how I've been supported. I love it, and maybe it's ambitious, but I hope to be a lecturer there someday in some shape or form. It is fair to acknowledge that there is some positive things happening in schools, because I have heard positive stories from traveller parents who have said they've got great support from the principals, year heads, particular teachers, and that's really, really positive and has supported traveller children in school. However, as we all know, there is an ongoing concern that traveller children will drop out of school because of lack of employment after ending their schooling, and because of racism and discrimination in schools and society. And we have seen a real negativity online during COVID-19. The last 18 months has been extremely difficult with the pandemic in relation to homeschooling, stress on parents with low literacy, poor Wi-Fi connection, no privacy, and very low IT skills. It has affected the well-being of children. Some traveller children really wanted to go back to school, but others haven't returned and are struggling because they feel they have fallen behind so far. It's not always easy for traveller children in school, as racism discrimination is there, as it is everywhere in Irish society. So we need targeted measures to support traveller children when it comes to well-being. The recent Oireachtas report on bullying in education has recommended that a separate mandatory module on school bullying and well-being, which would include racism, should be provided in all initial teaching education courses and continuous professional development for all primary and secondary school teachers. Unfortunately, in the area of work I work in, traveller, I'm a mental health worker, and suicide rates are the highest when it comes to the travelling community in this country, and children as young as 12 have died by suicide. Some traveller children, we need a holistic approach to traveller well-being and mental health. Some traveller children are going to school from overcrowded halting sites with limited facilities. Their life during COVID has been very, very challenging. And then we have the added problem of trying to keep up with their schoolwork with limited supports. These issues have added pressure, but also social media is also having a major effect on the mental health of young people and children. Addressing bullying and racism and online activity in school is necessary and would support well-being, but addressing well-being has also been linked to the overall living conditions, employment and conditions for travellers in Irish society. The government has promised a traveller education strategy, which needs to be addressed immediately and should include well-being and mental health as a core strand. Thank you, and I look forward to any questions or comments. Thank you.
Thank you very much, Patrick. You've raised so many important issues, which I'm hoping the people will refer to in the questions they ask, because there's a lot I could comment on myself, but I just have to say, just go for it. And of course, dream for the lecturers. There's no reason why you shouldn't get there. Just a small personal comment there. Okay, it's now my pleasure to introduce Eric O'Brien, who is the manager of the Southern Region in Foróige.
Good morning, everybody, and thanks for having me on this morning. I've been asked to give a short input on how youth services can work with schools to address well-being for young people. And really, just to start, I mean, for for close to 70 years now, Freud has been working with young people and communities. And we really believe that non-formal education should be seen as an integral part of young people's development in the broader educational ecosystem. I know that Pat and Deirdre mentioned earlier that well-being is a journey. It's not confined to any one facet of a young person's life. It moves with them from the home to the school and into our after-school spaces, which Freud works in. So it's really important that strong supports and the correct messages around well-being are reinforced in these areas. Youth work in schools have a responsibility to ensure that the way in which we support young people is holistic, as Patrick mentioned, is inclusive, and recognises the need for young people to have a voice in any discussion around their own well-being and their own mental health. So currently we work with schools all over the country, and there's a great openness to grow this collaborative approach around well-being. We meet the same young people, we work in the same communities, and we draw on many of the same resources to support these young people. The volunteers that young people meet in the after-school setting and in the clubs are very often teachers that they see in the school throughout the day. And Freud has a really strong commitment around supporting volunteerism, and we see that the impact volunteerism has in the wider community is a great support to well-being in young people. We currently support young people around the school day in many different guises. So whether it's breakfast clubs, after-school programs, or working with teachers and school completion programs to support young people who are at risk of not achieving to their full potential. And in some instances, and I can think of a number of examples, where right now we're working in life-critical situations with young people and their families. During the course of COVID, we worked with a school completion program in Limerick, where we were looking at supporting young people who had suffered from bereavement during COVID. And with the cooperation of the school and the school completion program, we developed a therapeutic response program, which was also linked to a wellness program. And those young people are they're still working through that program at the moment. It's shown a massive benefit, and it's made an impact in their lives.
Sorry, Marcus. Are you finished? Sorry, I wasn't sure.
No, I'm just have to move on a few notes there.
Oh, I see. I was wondering you paused.
No problem at all. So also, we know that the COVID pandemic has presented many challenges to young people. I know that some of the other speakers spoke to that in great detail. And we know how the formal education system has responded, and also the non-formal education system has responded. But we do realise that not all young people had the same access or the same opportunities. So it's had a really, really heavy impact on young people. But we've also learned with them, and we've learned that there are some new ways to address well-being, whether that's with therapeutic processes online or interventions online. So we're hoping that some of those will be able to make an impact over the coming years. And beyond this, I think we're looking at some of the programs that Freud has developed around health and well-being ourselves. And we are looking to grow strategic partnerships with schools, but also with the likes of the ETB, around how we might be able to pilot some of these programs and offer some of these programs to young people in the school setting. Because over the past number of years, that in-school setting and youth work, that boundary has become a little bit challenged, I suppose. Also, one of the things that I've been thinking a lot about is the progression from second level to third level for young people, because just like well-being is continuum, education is continuum. And we know it offers a great opportunity for us to explore how young people can grow in this really exciting phase of their lives. We need to support positive mental health and well-being for young people in employment, and the challenges that poses, the journey to third level, and the journey to independence in all its guises. So Freud is hoping to link with a number of colleges. I know we do some work with Pat up in NUIG and some other colleges around the country where we can explore this. But I was reading an article which I found really interesting only yesterday in the Cork Echo about some of the challenges around food poverty for third level students, which I found to be heartbreaking, to be perfectly honest with you. When we're talking about well-being, and you see that some young people in third level institutions are still having to go to food banks to secure food as part of their daily routine. I mean, it's something that I think that we need to look at in great detail, the infrastructural supports around young people in education as they progress to third level. And I suppose really just to conclude, I guess from our perspective as an organisation, we feel that the cooperation between the formal and non-formal education sectors needs to be grown and improved to a point where we see youth work not being as something that's nice to have, but is something that's really necessary to have for young people as they move through their journey in life. Thank you.
Okay, thanks very much, Eric. And I think one of the points you made about support around the school day, I think is crucial as we think about the best way to support children and young people and their parents. Okay, now I'm going now to move on to Rosie, who is CEO of the Dyslexia Association of Ireland. I'm really looking forward to hearing you speak, Rosie.
Thanks, Suzanne. Yeah, so I suppose, look, I'm going to speak obviously in terms of the impact we see in terms of children and young people with dyslexia, and I suppose which would be echoed by children with other learning difficulties or additional needs in schools. I'm struck when listening to the other participants as well that there's such variability in the experience. You know, both, let's say, if I just look at our community of children with dyslexia, their experience is varied. But then when we throw in all of the other complexities in life, other issues that people are dealing with, other disadvantages, etc., each individual case has its own different issues that need to be considered in a very kind of holistic way. We know, I suppose, that look, dyslexia and other learning difficulties place individuals at greater risk of poor well-being and poor mental health, lower self-esteem, stress, anxiety, and that this is before we even put things like COVID into the mix, you know, and the impact that that's had on everyone. We have just recently completed a major survey with our members and people affected by dyslexia in Ireland, and found that 42% of parents felt that COVID and remote learning had a very negative impact on their children's confidence and well-being. A significant minority, 32%, felt it had a positive impact, and then there was another 26% who were kind of unsure yet as to what the long-term effect would be. And I suppose that's quite an honest reflection on it. The negatives are things we've heard about already, you know, people feeling struggling to link in with Zoom. One young boy had such anxiety and panic attacks, could not cope with learning over Zoom at all. Their social isolation, poor broadband, inconsistent, you know, information coming from schools, just feeling really unsupported, unsure of themselves, frustrated, and to the point of getting just depressed and feeling they were falling further and further behind their peers, which then also created additional anxiety when they were coming back to school after those periods of lockdown. And then I suppose what's really interesting is looking at the children for whom being out of school was positive and what we can learn from that as well. You know, we know that school can be a very stressful environment for children if they have additional needs, especially if those are not identified or they're not getting adequate support. And there's a significant percentage, over 30% of children, where their stress and anxiety, their well-being was actually improved by being out of that environment. And if they were lucky enough in terms of getting, you know, one-to-one, that input at home, maybe learning that was a little bit more self-paced, but also where they weren't exposed to the stresses of school, be that examinations, be that not being asked to read out loud in class, having your spelling test corrected by the pupil next to you, or things like the classroom behavior chart, you know, the traffic light system where literally is, you know, it's almost a form of public shaming, you know, because you can't sit still because you need to movement breaks, but yet you're penalized for those in front of your whole class. And again, we also noted that parents, again, the huge stress that it put on parents in terms of their well-being. And I would very much echo what was said previously. We have to look after the carers, you know, so both in terms of supporting teachers and supporting parents, we have to look at how we can integrate supports for both of those important, significant adults, because if we want to be able to support our children, then those significant adults need to be supported to be able to do that. I certainly would welcome, obviously, the wellbeing initiatives being done by the department and in schools. They're absolutely welcome, but I think we would still see a huge amount of cases and evidence of, I suppose, dissonance in the wellbeing initiatives that are done in school. You know, they sometimes are done, but they're quite packaged and kept separate from a lot of, you know, what else happens in school. So I think we need to have much more analysis in schools and much more discussion around empathy and trauma-informed education, so that we're not just doing a nice weaving well-being input with the kids at the start of the day, but that we're not completely undoing that by 5 minutes later asking a child with severe reading difficulties to read out loud in front of a class with no notice of it, and the trauma that that is creating, or having their spelling corrected by the person sitting next to them on the table. So I think we need to look at how we can really create and have a more holistic system if we want to have a properly inclusive education system. I loved that point that Pat made earlier as well about, you know, maybe are we asking the opinions of our children and young people, but not actually doing what they want? And I think examinations is one area that we could really look at that. We know from, yes, calculated grades was maybe not a perfect process. It was rushed in. We were in a pandemic. You know, it was maybe not ideal in terms of how it was done. But the overwhelming voice of young people and parents and others is saying that, you know, having everything on timed terminal exams is not good, is causing huge stress and anxiety year after year after year. So we need to listen, and we need to make real changes in terms of, you know, how we're teaching, in terms of curriculum, in terms of properly weaving well-being right throughout every aspect of the school, and also in terms of how we assess our students, that we give them flexibility. We look at how we can be responsive to their individual needs.
Thank you very much, Rosie. It just strikes me listening to you, and this is a question I would sort of ask of all the panelists, is that one of the challenges is that each child is an individual with individual needs, coming from a particular family circumstance. And yet school is very much a group context. So how do we best support children as unique individuals with their own voice and opinions and life journey, with the reality that school needs to a certain extent, be quite structured, because the classroom sizes are quite big. And we even know now in the context of COVID, as you were saying, some children and families felt okay during COVID and some really did suffer. So it's a general question, really, again, just from your perspective, because there's no easy answers to this, as to how can we deal with that, if you like, that paradox of school being a group context, but yet each child is a unique personality with unique needs, deserving of an individualized approach. So is there anybody who'd like to respond to that? Maybe put your hand up and I can as well know. Great, Anya, over to you.
Yeah, well, I mean, I think you're right in terms of, obviously it's a group is made up of lots of individuals, but lots of individuals don't all need the attention at the same time on the same thing about the same issue. So I think what it's about is that schools have a culture of openness, and listening is really important, and the children within the school feel that. Do you know, it's not just about posters on the wall, it's about the sense of openness and that culture within a school that when you need somebody, somebody's there for you. This is sometimes seen as a small thing, but I still think it's very interesting in the fact that schools are still, as far as I can understand, the only place where children still call an adult by Miss or Mr. or Sir, and that does make a difference, I think. Do you know, in every other context, children will call the adults in their life by their first name, and there's a sense of relationship there, and I know there's a good sense of relationship between most children and their teachers, but I think those formalities sometimes can get in the way, and examining that is really important. I think culture is really important, and I think structures within a school that allow for children to have opportunities to have that individual approach is really important. So whereas we're generally dealing with the collective and the group and the structures within that group to make sure that we've got that culture of openness, there also needs to be structures where children are very clear about how they can access individual support when and if they need it. So it's having that culture and structure there that allows children, which is really important, that they act as a group. I mean, children find group really important to them as well, and that's a really essential part of their well-being, but also that they can access that individual support when they need it. But we constantly need to have our finger on the pulse of culture in schools and be looking at what makes the difference within that. And again, student and pupil voice in that is just essential, because it's quite often the adults that discuss culture and then develop it within a system. And in schools, it's just so important that the whole school community is involved in that culture setting and making sure that the culture suits all of the school community in terms of, you know, that kind of open communication and transparency in the way it operates.
Well, thank you very much. Would anybody else like to add or comment on what Anya's talked about? Hi, Rosie.
Yeah, I was just going to say, one of the things that we say a lot on our seminars and courses is what's good for dyslexia is good for all. Okay, and I think this applies to all individuals with additional needs or difference. We actually should be designing our school around the needs of those the most vulnerable, those who have additional needs. I think at the moment we're still struggling to get away from a kind of a one-size-fits-all approach, or an approach that really suits the kind of the average, as much as I hate that word, okay? Whereas if we actually pivoted and made sure we were designing our curriculum, we were designing how we differentiate instruction in the classroom, we were designing how we assess learning, how we do exams, continuous assessment, whatever. If those things were designed to be, you know, using principles of universal design and to be inclusive of those on the peripheries, the most vulnerable, those with additional needs, everyone would thrive. Whereas what we're doing now is if by not designing led by that, we are then trying to find ways to, you know, how do we help those individuals get over barriers, get over hurdles? So it is almost like, I think it's a changing where you, it's almost changing your perspective on where you start, rather than feeling that that's an add-on, you know?
Mm-hmm. Yeah, and just to the point about, you know, now diversity and inclusion, I was interested, Patrick, you know, you referred to the travel education strategy and the call on the government to implement that. Yeah. So I was just curious to say or to ask you really, is it one or a couple of key things you think that the government should actually be prioritising that should be happening in schools that isn't happening at the moment?
Yes, there's a few points that I can speak to, and the first one, just the previous speaker had spoken there, and I say it all the time, is the universal approach that we treat everyone the same. With all good intentions, you could do more harm than good, because different groups Ireland is so diverse now, our classrooms. For example, what might work for one community might not work for another. And again, we have to be aware and conscious of that our approach might work for this person, but might work for another. And previous speakers have spoke about, at the end of the day, teachers have a busy schedule and they're trying to manage a classroom full of children, and with all best intentions. So I would say the universal approach to one shoe size fit all. We have to look at that, because it doesn't work, and we've seen examples across all the mainstream. We've seen that in mental health services. We've seen that across the board. In regards to the travel education strategy, what I would say, Suzanne, is we can have the best strategies in the world. We can have all the best actions on paper, but if not implemented, if the targeted approaches are not implemented, and we're good as a nation, we throw money at things and let's make it work, and we do it this way, but we need the targeted interventions and supports with the view to mainstream. I would love to see travellers as doctors, solicitors, working in the mainstream, traveller lecturers, travellers in all these employment positions. But unfortunately, what we've seen is the job opportunities, employment is not there for travellers, and it's fizzling down to younger travellers. I've seen a case where a traveller girl has got great Leaving Cert results, but struggled to get work experience, let alone work. And that's low morale, and it's impacting on the community, because the younger siblings are seeing that. So any strategies that are being developed, there needs to be targeted initiatives. They need to have the voice of the communities. For example, I'm a traveller. We have Roma in Ireland, the Roma community. We have so many ethnic minorities. We have so many diverse groups of students in Ireland at the moment. But again, previous speakers have spoke about their core. They need to be, their voice needs to be heard and needs to be included in these strategies. And I always say it, that anti-racism and discrimination training, it needs to be core in the school curriculum, where teachers that are training in colleges gets this training. It's across the board, it's mandatory, it's compulsory, and I would see that would be a very useful tool. Again, I would see that we need to see that as an added value rather than just something, okay, we're going to do this training and tick a box. It doesn't need to be that way. It needs to be seen as an added value. And again, if tomorrow morning, if I had the aspirations to be a teacher, I'd like to know my class. I would like to know that, you know, am I doing good here? Is there something more I can do? And I think it'd have really, really lots of added value having that in the school curriculum.
Yeah, I think what you're referring to as well, Patrick, as well, is our capacity to have relationships. Yeah. To really be with and understand each other's perspectives, to value and appreciate each other, and continue to learn. Yeah. And I'm conscious that we're really near to our time, so I wanted to first of all to give Elena and Eric an opportunity to come in if there's anything they would like to comment on. Yeah, okay, Elena.
I was just going to say, I think probably one of the challenges and one of the dangers that we have around all of this is that well-being is put in a box, and other speakers have really alluded to this, but we talk to teachers all the time. And when I spoke to the staff at the Rights Alliance about being part of this, I thought, do we actually really belong in the world of well-being, and do we know enough about it? And then I thought, we're doing this all the time, every day. But of those 400 applications that came in from teachers in schools, 3 of them mentioned well-being. And it's quick search, lots of them talked about other things. They all talked about well-being, but none of them recognized that what they were doing in their school was about well-being. And they're extraordinary, the ideas that come through, like the bibliotherapy, the use of books, the kind of, some of them are using our Mind Yourself guide. These are all books about mental health and well-being, and they're pulling out displays for their children to talk about worries and sadness and low mood and grief and fear. They're dealing with well-being every day in what they're doing. They have Snuggle Stories initiatives where they send teddy bears home with the kids for the children to read to the bears at night. They have buddy bookshelves where they've got 4 or 5 copies of something, and you and all your pals can take it out together so that you can talk about it and build up your own connections. Everything that teachers are doing through the day is well-being. So I think what we potentially risk in having well-being as, the new buzzword everywhere, it seems, and I don't mean to undermine any of the policies or the initiatives, but I think what Patrick said around implementation of policies and what we're actually doing, it feels to me that there's a huge disconnect between well-being as a subject, as a policy, as a government, initiative over here, and what schools are actually doing in their day. So what we'd hate to see is that all of the, death by initiative, all of the programs are brought in and we're ticking boxes and we're doing things, but we're not actually focusing on the things that might make a really significant difference to children and that will be sustainable after that program is over.
Well, I mean, just to add really in relation to your point about well-being being everywhere, is how we turn up for each other is evidence of our own well-being in any given moment. Eric, is there anything you'd like to add?
Yeah, I mean, I guess just to add really that, in all of these discussions, I think what's really important to remember is that we have no greater experts on well-being for young people than the young people themselves. And I think by giving them the opportunity to have their say and have their voice and make that the focus of what we do when it comes to policy and direction of well-being and positive mental health. And I think that's where energy needs to go. And I was listening to what Pat was saying about young people as researchers, and I think that's really giving it back to young people to be able to shape how we do the research about all of this and how we implement change. So I just think it's really important we keep them as a focal point themselves about how they feel.
Okay, now just before we finish, I'm going to give you a few minutes just to think about this while I do some thank yous. Questions come in from the audience to say, if Minister Foley was here today, what one thing would you like her to take away? So I'm going to give you just a couple of seconds to think about this, and then I'll just go around. And to give you some time, I'll go around in the order with which you spoke. So Elena, you'll be first, okay? So while you're giving you some time to think, I just really, first of all, want to thank all of you for coming, all of you in the audience. I want to thank our keynote speakers, which is Pat and Deirdre. I want to thank all of the panelists here. I think it's been a really fruitful morning. I've certainly learned a lot. And I also I want to thank the people in the background who really supported the work, everyone at the CRA, in particular Stephen and Naomi, who've done Trojan work in organising this. So we're going to finish with the last word here is going to be Rosie. Just so you know, you're the last word, and then we'll be switching off. So the first person who's going to tell us what she'd say to Norma Foley is Elena.
So we would ask for €10 per head per child at primary school level to reinstate the school library fund. It would be €5.68 million, and that reasonable investment, I think, within the departmental budget would support inclusion, would support well-being, would help teachers to deliver on the curriculum, would allow children to see themselves in a book, to see others in a book, and would just be an enormous joy in schools every day for a long time to come.
Thank you. Anya?
Yeah, it's to set up the school mental health teams with the Department of Children and the Department of Health, and I think, you know, they need to come together and work together. This has been called on for the Ombudsman for Children as well, and I know Paul Downs at the last webinar from Children's Rights Alliance also called on it. So I think, you know, there's a lot of evidence to suggest these work, and I think we need to start implementing them in Ireland.
Thank you. Patrick?
It's going to sound a bit cheesy in the sense, but I think it's important that if the minister was here today, I'd say no child wants to be left behind. And I think that who knows travellers best than travellers themselves? We have the expertise when it comes to our community. So I think we're here to listen, we're here to talk, we're here with solutions. And I would say sit at the table and hear the traveller voices. Thank you.
Thank you. Eric?
So maybe just to look to value the non-formal sector alongside the formal sector, and knowing that young people's well-being doesn't stop at the gates of the school.
Thank you. And Rosie? Oh, Rosie, you're on mute. That's the first time I've had to say it.
Sorry, I would be the one person who did that. Sorry. I was going to say the phrase that I always come back to is the child, the paramountcy of the child, okay? And I think in all of these initiatives, whether it be around well-being or educational curriculum, formal, informal learning, mental health teams, I think the voice and the needs of the child should be paramount, because too often really good things are blocked because we've never done it that way before, or because of other vested interests. So I think if we could embed one thing as a principle to guide everything that we do, it is putting the voice of those most affected central to plans and to actions, and yes, listen to their solutions.
And that's a great way to finish. So thank you very much, all of you, and thanks for attending. Take care.